An Alberta Health Services neurologist has recently completed a preliminary study that shows a smartwatch can differentiate between tremor caused by Parkinson's disease and another less serious type of tremor that sometimes develops in older people.
Almost everyone has a tremor when they're nervous. They get shaky, and that's just what's called a physiologic tremor. And then there are other familial kinds of tremors like essential tremor, which is the other tremor type that we studied in this study. And there's many other different causes of tremor, but when most people see people with a tremor, they think of Parkinson's. And the treatments for Parkinson's and other tremors are actually quite different. So it's useful to make the diagnosis correctly early on.
Parkinson's disease is a neurodegenerative disorder that most often occurs after the age of 50. It can cause tremors, slowness in movement, and difficulty in walking. Medications commonly alleviate symptoms by increasing dopamine levels. In its later stages, Parkinson's can also cause problems with speech, mood, behavior, and thought. Don Williams, a participant in the study, was diagnosed with Parkinson's in 2009 and has so far avoided having to take medication.
He was doing some work where you put a watch on, and by working with computers, he was able to diagnose the tremor. He was trying to find out if there was a difference between essential tremor and a Parkinson's tremor.
All the smartwatches and these little bands nowadays have those accelerometers built in. And so my idea was, can we actually use that kind of technology to translate into the clinic something that's diagnostically useful? The reason I use a smartwatch is it's very light. The module is only about 20 grams, whereas the smartphone's usually about 180 grams or something like this. And so that can actually change the mechanics of the tremor if you weigh the hand down a little bit. So I wanted to use something as light as possible. And in a laboratory setting, usually you'd use a bunch of different sensors that are taped onto different parts of the body. But if you have something that's portable, you can use it in the clinic office. It's really easy.
More research is needed, but the study shows smartwatches could one day have clinical applications in helping doctors diagnose and analyze movement disorders.
As part of a clinic visit, you can collect data in less than 5 minutes at the end of the visit. And then that can be used for a number of things. So it could be used to track how well treatment is working. It can be used potentially in diagnostically difficult kind of situations where you're not sure if people have one kind of tremor or another. And potentially down the road, if it's easy enough for patients to use, they could actually collect the data themselves at home and send it over the wireless network to the doctor.
When you have Parkinson's, you have a lot of doubt in your mind about whether you really have it or not. If somebody can tell you that you have Parkinson's without having to go through MRIs and other kinds of things, I see a real benefit in that kind of a relationship.
The study went very well, so when we analyzed the data, the watch did a great job, so better than 90% accuracy in separating these two kinds of tremor, and so we're very happy with that.